Hello, and welcome to another episode of Arthritis at Home. Today, Ellen Wang joins me, the teammate at ACE, and we are going to talk to you about the last national survey of 2023 that ACE has conducted. This last national survey of 2023 looked at arthritis and health literacy. To walk us through a high-level summary of results, and I should say that these are part one results. We also are going to be publishing part two. Ellen is going to look at some of these key takeaways. Welcome, Ellen.
Thank you so much for having me, Kelly. And yes, very, very exciting to be able to speak to everyone about these results.
How do we define health literacy?
Yeah, absolutely. I think, when we think of health literacy, or when we thought of it previously, it was more around the concept of one's ability to understand health information, right? But what we've learned, especially in recent years, as the field has been pushed forward by scientists, is that health literacy is really the ability to find it, communicate it, and to actually then apply some of the basic health information that we gain through sources in our lives. And we apply it so that we're able to manage our own disease. We're able to, make informed decisions about our health, about to select from a multitude of different options that are available. So it's really the ability to find, to communicate, and to apply. So very broad now that we've kind of uncovered it a little bit more.
Which makes a lot of sense, because you can have access to this information, health information and knowledge, Ellen, but if you aren't confident using it, what good is that information, really?
Yeah, but if you are confident in using it, but you have no access, that's also a little bit of a hard place to be.
Right. So I think we try to explore this through the survey and the questions and different sort of focus areas in the survey. Maybe just tell us a little bit about the survey, Ellen, and then I'm going to ask you for some key takeaways.
Yeah, so the survey really was, we wanted to capture all those different components of health literacy. So our ability to find, so really thinking about the access, to be able to communicate, so interactions with doctors, with healthcare providers, with family, and then to kind of apply that. So what are the barriers to actually doing the self-care? Where are, the challenges that people experience? So really, looking at things broadly in terms of, like you said, access, those interactions, and then the application component. A rather long survey, but really trying to capture this broad idea and paint a more comprehensive or a fuller picture of any challenges in health literacy that we could possibly tackle in future.
I know here at Team ACE, we were really, really happy with the number of respondents who answered our survey. Can you tell us a little bit about the demographic and those numbers?
Yes, we before I tell everyone this incredible number, I just do want to thank again all of our respondents for taking the time to do the survey. And if you're wondering why some of these surveys are really extensive, it's because we're trying to capture nuanced or really specific information that tells a story about that specific person, versus saying people had challenges. Well, that doesn't help us, because we want to be able to create or know exactly what to create in terms of access resources, and to also share that with other advocacy organizations. We had a total of 1,148 respondents, so over 1,000 respondents, which is absolutely incredible. And the distribution was the best we've ever achieved. So in terms of gender, just about 50% of individuals identified as women, so just over half, just over about 40% identified as men. And then we also captured non-binary as well as transgender. In terms of age, about over a third of individuals were older than 54 years of age. About a third were between 34 to 53 years of age, and just under a third were about 33 years or younger. And then language, English was dominant. We found about 10% of French respondents, which is great. 5% had a primary language otherwise in English, and then we had about 1% of individuals spoke Indigenous languages.
What did we find as sort of some of the key takeaways from the survey?
So Kelly, we like you said, there was so much information that we gathered, and we've done a part 1 and part 2 just because we wanted to be able to communicate it to our audience, to you, in a way that was most beneficial and most digestible. And in this kind of first part that we did, we looked at all the groups, and we found that across all groups, individuals found it, or a common challenge, I should say, was knowing where to go to find health information, programs, and services. So where do we actually go to find those that are, for example, evidence informed, for example, that are in the area or have a healthcare provider that looks like you and speaks the same language as you? So that was, broad and a very, very much so an undertone to the entire survey. And the second piece was how to advocate. So this notion of self-advocacy that we've touched on previously was very apparent, that we as patients sometimes find it difficult to advocate for ourselves, whether that was, appointment times are really short, or that there's so many things I want to say and I end up not saying any of them, or you felt intimidated, or you didn't think that your concern was of importance, and how to be able to then speak up for yourself. So those two challenges were very much so common throughout. Another interesting trend that we saw was, with age, actually, confidence in terms of knowledge, skills, actually was better. So what we know is that our ability to self-manage and to apply our health literacy, put it to use, put it in the real world, takes time. It's something that takes time to develop. You don't, get your diagnosis one day, wake up the next day, and you're like, I'm an expert. And just embracing that, it is a learning process, and allowing yourself that time to figure things out, I think, is really important. And I think the last piece is absolutely key. Our survey found, our survey reflects that there's a little bit, there's a lot of work that can be done in terms of bridging the gap between what patients need, what is manageable for healthcare providers, and then what policymakers should be advocating for, to improve, like we said, the access component, the interaction component, and the application component to improve health literacy. It's truly about, a team, right? It's a team effort to improve health literacy across Canada.
That's interesting, that final point. I'd like to explore that a little more with you, Ellen. So, let's start. You talked about patients, people living with arthritis first. What can they do to overcome some of these challenges as it relates to health literacy? And I guess I'm particularly interested because I think what you're identifying is that it's those newly diagnosed patients, or younger patients, as you said, with less lived experience. What can they do?
So if you do live in a larger metropolitan area, I would look for different programs and services, right? There might be online courses to help you learn about health literacy. There may be a translational service or a patient navigator service that is aligned with your culture. I would definitely seek those out. So before, you go into your health interaction, just to see what is out there and how, try to find those online. We at ACE may also think about, maybe developing a page with all of those resources in mind, because those services, I don't want to say it exists everywhere, but they are slowly developing. And then with those resources and what you learn, it's really important to advocate for yourself, right? That piece of self-advocacy. So how do we self-advocate? When you're in an interaction, it's really hard. I know as a patient myself, I'm like, oh, I'm going to ask my doctor about this and that and that. I'm going to bring all these things up. And I go in, I just completely blank. So I'm really going to encourage everyone, you have an issue, you're experiencing something, write it down. I had my shoulder bother me for a week, especially when I did these movements, and what made it better? Just resting, it made it better, right? When you write something down and you even bring that piece of paper to your doctor, if you aren't able to communicate it, that information is there. And then I cannot, say this enough, but ask for support. Asks for support. As a person who lives with condition, I do find it difficult to ask for support. But as a person who loves to support others, I love being asked for support. I think, you may be surprised by how much your network is willing to and is happy to, is excited to support you, whether that's somebody to go to your appointments for you, to help translate, to help mediate, or someone to drive you to those appointments, someone to go to the pharmacy to pick up your medications with you, right? Ask your network, reach out for support. And then I'm going to say the last one. This one's a kind of a patient and a doctor thing. Ask questions, right? So if you don't know, ask questions. If you're with your doctor, ask questions. If you have someone super reliable that if they don't have the answers, at least they know where to point you, ask questions. We all
Yeah,
right? So continuously asking questions.
absolutely. I'm thinking again about those patients who are just starting their journey and just starting to try to access information. And one of the first sources they're going to go to is their specialist, their rheumatologist, or their patient support program. And those early conversations are packed with a lot of information. And sometimes, resources and health information, it might not come up in that conversation because there are so many other major life discussions going on. If you can remember to ask your specialist or your patient support program, where can I find information online as an example, they're going to likely point you into ACE, actually, to in our direction, and to other patient groups as well. So again, that might not come up proactively in a conversation, but if you ask, you will find out from these members of your healthcare team. So I think really important, ask questions and think about what those questions are before your consults. Now, as it relates to healthcare providers, members of the arthritis person's healthcare team, what can they do to help improve a patient's health literacy?
Back to the ask questions point is exactly what I wanted to add, Kelly. It was encourage your patients to ask questions. I know that sounds so silly, and I know that doctors do it, but continue to do it even more. And when you do communicate with patients, ensuring that it is clear and simple, but not only clear and simple, but check for understanding. Ask them to repeat it back to you, right? Ask them to, summarize the key points, and that way you're able to check for that understanding. And then I would say, really be careful with, especially if language is a barrier, with different medical words, not only from a perspective of non-understanding, but some of them may also, just because of the English language, right? There's certain words that may perhaps put someone off as well. So just being really, really careful with medical language. And if you can make it as conversational as possible, leaving lots of opportunity to ask for questions, that would, I think, from our survey, I should say, that seems like things that we know, but things that ACE will push and emphasize for medical professionals.
Really, yeah, really important. And I think in the survey, we did find particularly people diagnosed with an inflammatory arthritis, which is a very serious and complex chronic disease. Sometimes those conversations with your doctor can all of a sudden become fairly high level in terms of trying to understand, and for your healthcare provider to describe your disease. Make sure they're speaking to you in terms that you understand. And then finally, you mentioned policymakers as sort of this other key group or audience who we need to work together with to improve access to resources and share relevant and understandable health information for a patient's care. What can these policymakers do as it relates to health literacy?
This is kind of a dual task for policymakers and healthcare providers. But ensuring that online health information is relevant, it's frequently updated, it's easy to understand and written in a way, and presented in a way and laid out in a way that allows patients to make appointments easily, to find the directions easily, to navigate is absolutely key. And especially more and more as we look for health information online. I mean, how many times have we like individuals who have high health literacy gone online, looked for healthcare service, found the number, called, and like they no longer exist, or they moved, or that is the wrong number, and like we're like, why didn't someone just update this? But now imagine you're someone who doesn't speak English, or an individual who may be struggling with mobility, and you catch a taxi all the way there, and just to find out that the office is no longer there, that they moved across town. Like, how frustrating would that be? Like, so I'm going to really emphasize this to ensure that the health information online is frequently updated. Another point would be to work with researchers, to work with students, to work with different advocacy organizations to ensure that we're asking and we're including racial, ethnic, cultural minorities when we are looking for voices or trying to hear voices of what actions we should be taking. And you may be surprised that those voices may be saying something a little bit different than the usual samples. So just as a policymaker, being mindful, like, who am I asking these questions to, or whose opinion am I hearing, or what voices are really loud in my ears, and what voices could I make an effort to reach out to. And the last piece would be to really think about, we absolutely just know that this is undeniable, that individuals who have healthcare providers who look like them, who speak the same language as them, who are the same age as them, the same gender as them, have better experiences. So to ask ourselves, are the doctors, are the nurses, are the physiotherapists, the occupational therapists, I could go on and on and on, are those individuals representative of the population that they serve? And if not, what can we do, or what can policymakers do to ensure that those individuals have equal opportunity to pursue those professions if they want? Because there's a huge need. There's a huge need. It's specifically in certain sex and gender minorities. If you are a specialist in that area, people will drive to you, because that is how scarce that resource is.
Can you just give us a little glimpse to what people can expect when we publish part 2 results?
Yeah, so absolutely fascinating. We found that if we took our sample and their responses, and then we separated them by, for example, gender, they look relatively similar. Awesome. We separated them by age. We saw that trend of, more or less, as we age, our health literacy actually gets better. That kind of makes sense though, right? we're gaining more information, we're getting better at certain behaviors. Okay, also makes sense, everything looks great. But then when we dissected it by cultural ethnic group, we found that, oh, it's same. That's good. We think that's good. But at the same time, we're like, this is interesting. Can we dig a little further? So what our team did was we looked at the intersection of age and ethnocultural identity. And we found that even though on the surface it looks like everyone's responses are very similar, there's a certain group, and that group was ethnocultural minorities over the age of 54. Those individuals had a stark difference to anyone who was an ethnocultural minority that was younger than them, or individuals who were white, for in this case. And you're like, that's so interesting. So when we just dissected the pie by 2, the pie looked equal on both sides. But when we cut a little bit further, when we zoomed in, we found that that's very interesting at the intersection of, in this case, ethnocultural identity or race and age. There was a significant difference. So there's always groups that we can be, really pushing to reach out to do more for, to hear.
That's excellent. Thank you for that summary. I guess what I'm hearing is if a person is experiencing challenges finding information, understanding that health information, or using that information, they're not alone. There are a lot of Canadians living with arthritis who are experiencing those same challenges. And that's, in a sense, why we're here. And we encourage everyone watching and listening, come visit our website, go through the different sections and the pages. You'll be able to find the information, and I think it's laid out in a way that's pretty easy to understand. And we help you also learn how to use it. And that's the formula. But you're not alone. And there are resources out there. Keep asking questions.
Keep asking questions.
Thank you for answering many of those questions today, Ellen.
Always.
And I look forward to discussing part 2 with you in the coming weeks. And to our viewers, thank you for joining us. And we'll see you on the next episode of Arthritis at Home. Bye-bye.
Bye, everyone. Thank you.